for having me. I am excited to speak today about some new migraine therapies for kids. I'm gonna go ahead and share my screen and hopefully everyone can see that. So the focus of my talk today is actually going to be on some neuromodulation therapies that we use for migraine. A lot of times when we think about migraine therapy, we think about medications, but there are a lot of other options out there, some with more recent approval specifically for the pediatric population. And so if you've never heard of neuromodulation for migraine, neuromodulation is essentially conducted with some sort of device, and it's either going to use electrical currents or magnets to adjust or change the activity that's going on in the brain, specifically around how migraine works. So some of these devices will stop an attack. Those are like our rescue medicines, essentially. Others will be used more as a preventive, so prevent future attacks. Right now, there are about 5 FDA-cleared neuromodulation devices on the market specifically for migraine, and 3 of those 5 are now cleared for use in children 12 to 17 years of age. And so we're going to talk about, in this talk, those 3 devices. Before we get to the specific devices, in general, when we're talking about neuromodulation, who is really a good candidate? And really anyone could be. Specifically, we start to think about neuromodulation for those kids who have conditions that prevent them from taking medications. A lot of times what I see in my clinic, a lot of kids who have comorbid conditions like autoimmune diseases, they may be on other therapies. And so the therapies they need for those conditions require certain medications that might interact with the typical medications that we use to treat migraine. And so that's where neuromodulation comes in for those kids. There are some who have tried the medications and they're maybe effective, but they're not tolerating those medications due to side effects. In general, there could be concern about medication overuse. So I'm using my medications, they're working when I use them, but I'm worried about overusing them, which can be a big problem with some of our rescue medications specifically. And then, of course, there are those who prefer not to be on a medication, traditional medication at all, and they're looking for more alternative pathways. In kids, this is especially the case. A lot of parents are hesitant to commit their child to a daily prescription medication, understandably, or frequent use of rescue medications. And so, in those patients, this is a good option as well. And so the first device I'll talk about is a type of stimulation called transcutaneous magnetic stimulation. There's a device named Savi-Dual, and it's had different names and different iterations of the same type of device, but it is an FDA-cleared device for acute and preventive treatment of migraine in children 12 and up, and it got that indication in February of 2019. You do need a prescription for this medication, and the cost is variable with all these devices, but it's going to cost you somewhere around $350 per month, which is up there. And so how does it work? So essentially, when we think about magnet therapy, most people are familiar with is MRIs and how they work using magnets. And so it's not quite the same strength as an MRI machine, but you're using magnets to send electrical impulses that can either stop a migraine attack in its tracks, or with daily use can prevent this hyperactive kind of pathway associated with migraine from happening. And so I think I have a picture, let me see, on the next slide. Yep. And so this is what it looks like. So you're going to hold this device on the back of your head. There's a button you press. It's going to release that, like we talked about, that short kind of magnetic pulse. You can start it at the beginning. If you have an aura with your migraine, start it when that starts. Because obviously, even with medications, devices as well, the sooner into the attack that you can use your device, your medication, the more likely it is to get rid of that attack. And so the sooner the better. So with your aura, or as soon as that headache is coming. And if you're going to use it as more of a preventive treatment, you're going to schedule the use of it twice a day. Okay. The other cool thing about this device and a lot of devices is that they track how often you used it and how many impulses you had to use. And so it's information you could take to your provider to discuss further treatment options, what's working, what's not working, and continue to modify therapy. Okay. And who should not use this device? So you want to really use caution with any sort of metal implants. The precautions that are listed with this type of device are similar to patients who are cautioned to not use an MRI. So any sort of implanted device in the body where you shouldn't be around a magnetic field, you wouldn't use this device. Pacemakers, VNS that's implanted that you may have for epilepsy, or any sort of cardiac defibrillator, anything like that would be a reason to not use this device. Another really, really cool device is called GammaCore. It's a non-invasive vagus nerve stimulator. It's been around for a long time. It has FDA clearance for multiple medical conditions, multiple headache conditions as well, but it is now indicated for the preventive treatment for migraine and acute treatment in migraine 12 and up, which is a newer indication. Interestingly, it's also approved for use of cluster headache, hemicrania continua, and paroxysmal hemicrania, and there are no other devices that have indication for those conditions, which is interesting thing about this device. So in order to kind of understand and appreciate the vagal nerve stimulator, it's good to understand what the vagus nerve does. It's a really cool, really important nerve in the body. We think of it, you can call it the superhighway of the nervous system. It sends communications to not just the brain to and from, but many other parts of the body. And so another big important organ that communicates with is the gut. And we know that it has this brain-gut axis that really impacts a lot of medical conditions, including migraine. And so it really has a cool mechanism of action. The vagus nerve is located in your neck. And so you stimulate it, it's kind of right below the angle of the jaw. You feel the carotid pulse and kind of go diagonal next to that and provide a stimulation. And it's gonna work by, in theory, suppressing this cortical spreading depression. It's kind of the buzzword that we say is behind the pathogenesis of migraine. And so kind of stopping that in its tracks. So really cool device that, again, works preventive and also works as an abortive or rescue. So for acute treatment, at the earliest sign of pain, again, really important, you're going to give two-minute stimulations on the same side of the neck as needed. And you can repeat that if the pain continues. And this little picture is kind of what the device looks like. It has these two, I don't know if you see my mouse, but it has these two little prongs here. You put gel and you put it on your neck and you would hold it there for 2 minutes. And then you could repeat the treatment as needed. And then if you're going to use this as a preventive, you would use it in the morning and then you would use it at night. And the treatments are similar. You're going to do two-minute stimulations on the same side of the neck, morning and night. And this is regardless if you have a headache that day or not, similar to how we use other preventive medications. Pricing, GammaCore right now, 3 months of therapy is about $200 per month, and the first month is free. So I've inserted some of the information where you could find out about it, and the website's really good. They have their frequently asked questions section, gives details about how you can get this medicine, and you can use on their website, you can look up prescribers of GammaCore in your area to see if there's someone that can help you get this device. And so important safety things, again, similar patient population will avoid this if they have implantable medical devices such as pacemakers or any sort of other implanted device like implanted VNS, any sort of metallic device at or near the neck. You're going to want to avoid using this. If there are patients who have any known cardiac issues, congenital heart issues, had surgery to the vagus nerve, these patients aren't going to want to use this device. So it's something you want to talk to your healthcare provider about figuring out, is this device right for you? But it could come in handy if you have migraine, you have GI issues. It could be something that could help treat potentially both of those things. And then another cool device to talk about is called remote electrical neuromodulation, or REN. This one is newer. Narivio is the name of this device. It was FDA cleared for the acute treatment of episodic migraine first in adults, and then it was extended in chronic migraine patients as well. And then in 2021, finally received FDA clearance for patients 12 and older, so in the pediatric population. Another one that's only available by prescription. Cost is variable for this device, but it's on the least expensive kind of part of the spectrum when it comes to neuromodulation devices. Depending on insurance coverage is variable, but you could pay anywhere from a $10 copay, at most $99 for each refill. This device works a little bit differently. And so it's a device you wear on your arm. And it stimulates small nerves on the upper arm where you can kind of see, let me bring my mouse over. This area right here is going to provide a stimulus. The message is going to be received by a pain regulation center in your brainstem, and it's going to work by inhibiting the pain signal there and resulting in significant pain relief, which could end your migraine attack. This one is used as a rescue. And so it's specifically stimulating something peripherally, which makes it different from the other two devices. This is what it looks like. The one on the left is what it looks like, and kind of the interface of it's really cool. You use your smartphone, and that's what controls the device and also keeps track of how often you've used it, which is really a nice feature of this as well. Here we go. Who shouldn't use this device? Anyone who has congestive heart failure, severe cardiac or cerebrovascular disease, or uncontrolled epilepsy, anyone with an active implantable medical device. As you can see, these are all pretty similar as far as who should not use them. So this will be in discussion with your provider as far as how to use it. So with this device, right now, the indication is for rescue. This could change going forward. And those are the devices I wanted to cover. So I'll just stop and just see if there are any other questions. I think I see some in the chat.
Yeah, there's a question in there.
About Cephaly.
Yeah.
My 15-year-old daughter tried Cephaly. It made her sleepy the first time. The second time she said it was too strong. I'm very familiar with Cephaly. Technically, you know, it's only cleared 18 and up, but lots of younger patients will use the device. Some people will use their parents' device or a family member's device. It's nice once you have it. And you can continue to use it. And so side effects are variable for all of these devices. But the sensation that is created for them can be intolerable for some. In the studies that they've done for a lot of these devices, it was rare for intolerance to occur, but it can definitely happen. It just depends on the person. Sometimes people who have allodynia, which is more scalp sensitivity, don't tolerate these devices as well. But the Cephaly device is something that technically could be used. You won't know kind of what effects you'll have until you try it, unfortunately. Any devices for children under 12? No, at least not yet. Hopefully coming down the pipeline. As you've probably noted with a lot of the migraine, especially the newer therapies out there, everything gets tried and tested in the adult population. You get this robust data set. Usually then there'll be some follow-up studies in children. Typically the age range is 12 and up. And the last group that gets studied tends to be ages 6 to 12. And that's just because when it comes to kids, we're a little more overprotective, and we require a little more data before those things get approved. But essentially, it may be coming. It may be coming. Let's see. 12 and up, yes. For now, technically, they're FDA cleared officially to be used for kids who are 12 and up. Now, are these devices used in younger kids? They certainly are used off-label for that reason, just like a lot of our other medications that we use for migraine sometimes. We'll use them in the younger patient populations. When we do that, it's called off-label use. And so that is sometimes something that we do. Barriers when it comes to medications to doing that can be insurance approvals. A lot of times with devices, insurances don't cover them. Sometimes you can use health savings accounts and things like that to get them paid for, and they are a little bit more on the expensive side for some of them. So that can be a barrier, but insurance approval is not technically a barrier. So if you talk to your provider and they think that it's the right choice for you and you guys decide together to try it, and you're someone who's under 12, insurance wouldn't be necessarily the barrier to you getting the device. Let's see. My daughter's 9 and has used Nerivio about 4 times, and it hasn't worked very well. Should we ask for another type? She has a daily headache since 1/5/23. Yeah, that's tough. I would say since Nerivio, it's one of those that you use at the onset of an attack. I don't know how long she's been using it, but if it hasn't worked very well, I would at that point try to see if another device could be helpful. You've given a good try. Let's see. So how long does a refill last? It depends on how many times you use it. So because it's not one of the ones that you use prescribed daily, it depends. So if you have how many refills come in each one, I'm not exactly sure, but how often you'll need a refill just depend on how frequently you will use it. But I don't remember off the top of my head how many refills you get with the Nerivio device.
Dr. Forte, can you speak to using multiple devices, more than one in the same, not at the same time, of course.
Yeah, that's a good point. So as you saw, a lot of the devices have different mechanisms of action. And so technically you could try to use multiple devices and try to hit it from different ways, similar to how you would use different preventive medications. You might try a medication in the anti-seizure class of medications, and then a medication in the blood pressure class of medications. And so because they have different mechanisms of action, sometimes they can work well together. You don't want to use them at the same exact time as mentioned, but sometimes you can use one device. Maybe one device works better for you as a preventive, and then the other device works better for you as a rescue. And so it's one of those things with trial and error, and through keeping a really good headache diary that you could talk to your provider and figure out a regimen that's tailored to you.
Would you say that generally, do devices, if you're using preventively, do you need to try it for 30 days usually?
So when you're using a preventive device, you want to try it. I usually say at least 60 to 90 days of use of the device before you say it doesn't work, especially when you're using it as a preventive. And that's the same thing I would say for a lot of the preventive medications. The nice thing about the devices is on their website, they'll often give you a window of money back, a guarantee, send the device back, get a refund if it doesn't work within 90 days. I think that's what Cephally says right now. But a lot of the other devices have similar kind of money back guarantees behind them, because it is a big upfront cost sometimes, which can make families hesitant to try it. But knowing in the back of your mind, okay, if this doesn't work, I can stop using it or potentially send the device back and get a refund for it. All those things are options. So give it a good 60 to 90 days, I would say.
Okay, we do have another question in here. Thoughts on using an OTC TENS unit for migraine, which these devices are not TENS units, right?
Right, so they're much different
about that.
Yeah, that's a good question. So the TENS units, for those who don't know, you may have seen them either in like a physical therapy office. Sometimes they'll apply them, or even a chiropractor office. They'll kind of apply them to various areas, and they'll give like more of a massage kind of sensation. They're vibrating sensations. They're quite variable, a lot of them, as far as what they can provide. You can use them. I recommend using them not directly for the migraine attack prevention or rescue. But if you have a lot of neck tension or muscle tension that's maybe contributing to the frequency of your headaches, using it as a form of massage therapy can be a good idea. It's not something I would recommend, like putting them on your head and using the sensors on your head, because they're not made for that. A lot of times the sensation will be too strong. It can be painful if they're used that way, but used the way they're supposed to be used for more of like muscle relaxation, things like that can be really helpful.
Okay, we have another question in the chat.
Yay, I'm glad we have a lot of questions. Where is a good place to start with preventive medications for children? I have a 10-year-old with frequent severe migraine. Abortive medications aren't cutting it anymore. Too young for the devices you're talking about today. So as far as medications, we're always, before we get to medications and we're talking about prevention, you've probably heard it up and down as far as like looking at all the lifestyle modifications I can do, making sure we're getting great sleep, good quality of sleep, ruling out things that could be interrupting sleep, which could be causing a lot of headaches like sleep apnea. We're really getting a good idea of our water intake, trying to cut out caffeine if it's in use frequently, staying as physically active as possible, which can be hard to do when you're having frequent headaches, but can be really helpful. Making sure we're eating regular meal times. So we're getting all that kind of, that's where we start with that, the basic foundation of headache prevention and kind of managing once we've gotten to that point of having a lot of headaches. You also want to make sure that you haven't been overusing any of your abortive medications, because sometimes it's one of those double-edged swords where, well, I'm having a lot of headaches, I'm taking my rescue medications, they're helping, but the headaches are still increasing in frequency. And I found myself, going from one a month to one a week to multiple a week. And now, oh my gosh, I'm using my rescue medications every day because nothing else is helping. So I would look and see, make sure medication overuse is not contributing to the frequency of the headaches. And then of course, with a child, I know you said it's too young. So I'm assuming just under 12, where's a good place to start? There are several medications that you can use as preventives. For the youngest of young children, we'll often use a medication called cyproheptadine. The other name for it's Periactin. It's in a category of like an allergy medication, can be used for kids who have a lot of headaches. Also can be an appetite stimulator. And so for those who have a lot of nausea or trouble getting food in because of the frequent headaches, it's a nice medicine to use. Other medications that we use frequently in children that have good evidence behind them are topiramate, which is in the category of an anti-seizure medication, but has a lot of data behind its use in children. And then the other medication, actually, maybe not. And then the other medication category that we'll commonly use is in the medication of mood stabilizers or antidepressants. You may hear of amitriptyline or Elavil as a medication that's commonly used. Sometimes in younger kids, not so much, but sometimes we'll even use a category of blood pressure medications. A common one that we'll use is a class of medicines. They're called beta blockers. Propranolol is one. We have to watch vital signs, especially in younger kids, if we're using that medication. But there are several good preventive medications that you could start with kind of out of those categories in conjunction with really nailing down the lifestyle stuff, I would say. So hopefully that answers your question. That was a mouthful.
Can you speak to Nurtec? Is it approved for pediatric? Well, it's in trials, right? Or it's going into.
Yes, that was what I was going to talk about next. But I knew I was going to get questions on it because everyone wants to know about CGRP. Everyone wants to know about those different medications. So Nurtec, which is rimegepant for those who don't know or aren't familiar with it, is a CGRP blocker, oral medication. Not yet. We're all just waiting for all these medications to be officially approved in kids. They're not yet. There are several trials that are ongoing. We're actually getting started with a Nurtec trial actually at our center. And so if you're interested in getting started on one of these medications, there are trials at a lot of centers. You go on the website and you could look up sites where clinical trials are being conducted. The downside is for some of the trials, you don't know if you're going to be medication versus placebo, but being enrolled in the trial can really help with moving forward with getting these type of medications approved. But I'm hoping, and we're all hoping, that the approvals are coming soon. We have a lot of good data so far that shows that they're safe. And and effective medications in adults, and the safety data for kids is really good too. And so hopefully it's just a matter of time. Let's see.
There's some other questions about.
Okay, someone, I knew someone would know that Nervio's 9 to 12 treatments per box, which makes sense. It's actually kind of similar to the triptan class of medications when you think of rescue. How do you spell?
Somebody wants to know, how do you spell some of these medicines? So I can type them in the chat, which I guess you were speaking to the beta blockers and the anti-seizure meds.
Yes, so the ones so far that we talked about, I know that, and everything is confusing because everything has 2 names. And
Yeah,
so
I'll put them in here.
you'll put them in there, and then if
Yeah.
there's any missing, I'll kind of look and I can type some in there too. Supplements. Someone brought up supplements. Are there any good ones that we suggest? Yes, we use supplements all the time, and especially in the pediatric population. The supplements we like to start with are magnesium, has some good evidence behind it. Riboflavin, which is vitamin B2. Melatonin has some good evidence for use as a preventive, even in kids who don't have issues with sleep onset. Melatonin just has some good evidence behind it for being helpful as a preventive. If your vitamin D is low, there's some good evidence out there that that can make you have more frequent migraine attacks. And so I'll sometimes check vitamin D levels in my kids, and if it's low, replete that to try to decrease the frequency of migraine attacks. Same with low levels of iron, ferritin, which is iron storage. If those levels are low, being on iron supplementation can be helpful. There was a small study, a recent study that talked about zinc as a migraine supplement. That was pretty cool. It had some small evidence behind zinc supplementation. Any supplements that you do start, you don't want to be buying a bunch of supplements and trying them all out. There are some when it comes to migraine that have good evidence. I would say the top 2 are magnesium and vitamin B2, regardless of what your levels are. Even if you have normal levels. And so those are the ones that you'll see marketed in other products like MigraLeaf or MigraVent. They have those supplements in them. Those will be the big ones. Those will be the big supplements that we typically use.
What type of magnesium do you normally like to prescribe?
We love to use magnesium oxide. It's usually the one you'll find. It's available pretty regularly, readily over the counter. Don't use magnesium citrate, whatever you do, because that will make you run to the bathroom. Some people are really sensitive, and even magnesium oxide can make them have looser stools, but magnesium citrate will clean you out. So I would avoid that.
Okay. Can you speak to, is there a max dosage on, what are I guess the doses that you prescribe for magnesium and riboflavin, are they the same as adults or lower?
It is most of the time. So if you're a teen or adolescent who's more than 40 kilos, you're typically going to get prescribed adult dosing of the supplements and a lot of the migraine medications in general. But anywhere there's a range. So with magnesium, anywhere from 200 to 800 milligrams a day is what we'll prescribe. With riboflavin, you'll see doses from 100 to 400, sometimes a little bit higher than that. As well. Higher doses typically aren't harmful, but oftentimes you're just peeing all of the excess out. And so more than that is usually not effective.
Yeah, expensive pee.
Exactly.
Is there a max dosage of melatonin?
That's a good question. The max, as far as like what the sleep doctors will tell you, is that more than 10 milligrams in general is not, if it's not effective, then don't use more than that. There are other studies that came out and showed that there's not really a max dose of melatonin that you can take. And so I would say no more than 10 milligrams, which is what the sleep doctors recommend when it comes to insomnia and trying to improve sleep onset. From a headache standpoint, it's usually recommended anywhere between 3 and 6 milligrams. But oftentimes people are using those doses for sleep and may increase it a bit to try to get more benefit from a headache standpoint.
Okay, someone wants to know about the antihistamine like medication. I mean, that is a medication, right? And antihistamine is a preventive.
Oh, and I think that's what they wanted to know the name of it. That's the
Oh,
cyproheptadine or periactin, which I can type in there.
I got it.
You got it?
Yeah.
You're
The,
good. All these medicines are hard. They are hard to spell and pronounce.
the next question is thoughts on thoughts on
CoQ10. Oh, I see.
CoQ10 and Butterbur.
And Butterbur. These medications, so CoQ10 is another really good medication. Sometimes it's not always prescribed as a standard, like in your migraine supplement pack. I'll see it prescribed a lot for kids who have cyclic vomiting syndrome or abdominal migraine, or migraine variants. We use them, and there's some evidence for using it in those conditions. But also, there's some evidence that it helps with fatigue. And so if someone's coming in and fatigue is a big complaint, I'll often then add on coenzyme Q10 to help with energy levels. So there's some small evidence for that. Butterbur, go ahead.
Did you say that? So you said CoQ10 is used sometimes for abdominal migraine. I actually didn't know that. Okay. All right, good. Thank you.
And then, yeah, of course. And then Butterbur, it's hard to find in isolation. You probably have to order it online, but it's often found in things like which one is one of them is Feverfew, one of them is Butterbur. I always mix them up, but Migraleaf and Migravent have one of those, Feverfew and Butterbur, added in with the riboflavin, which is vitamin B2 and magnesium.
Do you ever use them together, Butterbur and Feverfew?
Actually, I've had patients come to me who are taking Migravent and Migraleaf and getting it that way. They're taking both. So
Right.
They may be taking one in the morning and one in the afternoon, which is fine because actually when you look at the dosing of magnesium and riboflavin, it's often on the lower end of the range. And so that makes sense. It kind of gets you on the higher end of the range of the magnesium and the riboflavin, and then you get a little bit of each of Butterbur and Feverfew. So that's a good option to do as well. It's a good option to do as well.
Okay. Let's see. I think you already answered the question.
Someone said that, yeah.
Magnesium.
Oh, and Feverfew, someone mentioned that.
What about magnesium glycinate? I know some adult neurologists recommend that one.
Yes, it's something you could try. I found that it's difficult to find. It could be challenging to find. So that's the only issue I've run into it with. But it's worth a try. You can try either Mag-Ox or Mag-Glycinate and see which one helps, works a little bit better, however you get that magnesium in.
Okay, dosages for CoQ10.
Oh, they're so variable. You can use anywhere from 100 milligrams daily. Some people use 300 milligrams daily. You can go higher than that, but the evidence after going higher than 300 milligrams daily is variable. So we'll usually stop somewhere around there.
Plus it costs a fortune the higher you go.
That's exactly right.
Supplement. Somebody's saying that her daughter has trouble taking pills. Which supplement would you recommend focusing on first?
With trouble taking pills. Any of them could help. None of them that I can think of off the top of my head come as a liquid. You could get magnesium as a powder supplement. A lot of people like the Calm supplement, but I think that one is magnesium citrate. So they're also using it to clear themselves out a little bit. So if you don't want that effect, I wouldn't recommend using it. So you could try maybe a powdered version of magnesium if you can find it. It's really hard to find all these things in gummies or liquid formulations. So I would say practice swallowing pills, which sounds really silly, but anyone can do it. It is really hard. I usually, for all my patients who say they have trouble swallowing pills, once you're diagnosed with migraine, it's time to learn how to do it. And so we usually go over how to practice, and you can start with little tiny nerds, the candy, to practice swallowing those. And then you can graduate up to like mini M&Ms. And then once you conquer those, you can go to regular M&Ms. If you can get regular M&Ms, you can get a good amount of pills from there. Some people go higher. We have our child life specialists who help kids learn how to swallow pills in the hospital. They can go as far as the candy they use. They can go up to Migraine, which are really, they're big.
Oh,
So
wow.
they so they'll slowly teach you how to swallow pills. But really, it's, I always say, it's hard to convince your brain to swallow something that you haven't chewed. So your body is trying to protect you, and some people's brains are more hard to overcome that than others. So it takes practice. But if you think about it, the food after you chew it, the size of it is much bigger than any pill that you're going to swallow with a little bit of water. So it can be learned. It's just really hard to learn. And for some people, it's harder than others. But definitely work on practicing, because it's hard to find these medications in liquid formulations. And when you do, they're really expensive. Or you have to send them to compounding pharmacies and things like that. So the price of them can add up.
Hey, Beth is saying there's a liquid B2 and magnesium has a gummy, so who knew? Migraine is a liquid capsule, and I put a spoonful of Nutella. Oh, well, I would eat that too.
Ooh. That's a fun way to get it in.
Yeah. All right. Those are some good comments in here. Did you, let's see, Butterbur is a vasodilator. So if POPs is co-occurring, probably not a good mix. I don't know. I didn't know that either.
Yeah,
so we've answered all the questions. I can see that people are putting comments into the chat. And I guess, is there anything else, Dr. Forte, that you wanted to share?
No, you guys, I'm glad we got a lot of questions.
Yeah, that was a lot of questions.
It was good because you never know which way. I was preparing myself for all the CGRP questions, but you didn't. You guys probably are so up to date on all of that now and just kind of waiting for pending approval. And so, yeah, I think hopefully while we're waiting, now we know a little bit more about some of the devices that are available. And so there are ways to get other things while we're waiting for all these other things, medications to come down the pipeline. It's really hard waiting for approval in the pediatric population for these migraine therapies, but there's a lot of hope with the therapies we have now and what we know is coming down the line.
Can you comment on Botox? My daughter got that when she was 16. Yeah, so
yeah,
that's, that can be prescribed, right, and under the age of 18.
Yeah, so yeah, Botox is technically, FDA 18 and older, but as you all know, a lot of the times we can make a case for you to use it off-label younger than that. We have a Botox clinic, so I do Botox at Children's Healthcare of Atlanta in patients who are under 18 as well. The technical indications for Botox is chronic migraine, so 15 or more headache days a month, 8 or more of which are migraine attacks. And so Botox is a great option. It's been around for a really long time. So it's tried and true and safe. And a lot of the evidence coming out now is one of those meds that are like, we don't know why it works. It just works really well. A lot of the studies show that it was working because it does impact CGRP levels. And so now it's something we've known once we've learned about CGRP. So that's really cool. And there can even be an additive effect in combining Botox with some of our new CGRP medications. So all this new information about Botox and CGRP is coming up. It involves injections basically to muscles of the face, head, back of the neck. There are 31 total, which sounds really intimidating. Needles really tiny, like a little acupuncture needles. People say they feel like a little pinch, but it can be a lot. The nice thing is that you don't have to do it yourself. You come and let your provider give you injections, and you don't have to think about it for 12 weeks. And it's something that you get every 12 weeks. So it's a great option, safe option, tried and true option for sure. Let's see.
Was there a coupon for Gammacore? I think, I know we had one.
A coupon. I don't know, but I can go back to that slide.
We can put it in the chat. Is this a coupon though?
No, that's not. I don't know that this is a coupon. You don't need a coupon to get this new discount
I
on
think
it.
that's just a set price right now that they have going on, isn't it?
Yeah, and they change so much with all these companies. A lot of
Yeah.
times I don't know the price until I look in during the visit at that moment because they fluctuate.
They just changed the pricing, actually. I want to say they changed it in the last couple of weeks, because it used to be $350 a month.
Mhm.
And they definitely lowered the price, so.
They did, and this was as of, like you said, I got this information last week. So this is the newest information. Yeah.
Mhm. What about Relivion? Have you heard any, I don't, is it indicated, do you know, for under the age of 18?
Not yet, but I think it will be. And I'm always surprised that Cephally isn't yet, but I think Relivion will be. Not yet, but it's also a really cool device, actually, that you can try, and it works. It's like I wish I had a picture. Where Cephally is kind of in the middle of your head. This one, it looks like more of like a helmet. And so
It's like a halo.
Yeah, so it's kind of
Yeah.
stimulating the occipital nerves as well. So it has a dual stimulation on it. But it's a really cool device. I think it just came out late last year.
It just came out. I just put the link in the
There you
chat.
go. Yeah.
Yeah.
So that'll be really cool. I hope that a lot of these companies will start to work towards approval in the pediatric population. I really do, or FDA clearance in the pediatric population. But we know that these devices are really safe. The evidence behind them is really great in the adult population. Side effect wise with these devices, you don't see much. And if you have any side effects while using the device, they go away once you're done using the device. And so rarely, sometimes somebody will, the device sensation may trigger a migraine attack, so that may persist, but any other sort of weird symptoms that you may get typically go away shortly after you discontinue use of the device. So they're really safe to use. They're good. So even in the ones that are only approved 18 and older, if you talk to your provider, they might feel comfortable prescribing it.
Mm-hmm. Wow. Well, we got a lot covered in 50 minutes, less than 50 minutes. So you have 10 minutes left in your day, folks, to go explore the devices. Dr. Forte, thank you so much for your insightful and inspiring presentation. And thank you everyone for being here. I put the survey in the chat, so if you can just click on it, you can disconnect and do it. You don't have to stay on the Zoom while you're doing it. And this concludes our program, and I want to thank again US Pain for being here, and it's great to collaborate. Our two organizations have a lot of resources for you and your families. We'll be sending out information in the follow-up email, but you can go to our websites, US Pain Foundation and Miles for Migraine. We're both nonprofits, and we want to help as much as we can. So thank you. And we have a race in Atlanta this year. We have a walk run. If you're from Atlanta, please come to the Miles for Migraine Walk Run Relax. I should know the date, but it's on our website. You know the date.
Too many.
Yeah.
I can tell you when I look at my calendar, it's April
1st.
Oh,
This is
good. Thanks,
Mavish. April.
Oh, thank you, Balish.
You're welcome. You're welcome. Thank
We need to bring more awareness to pediatric migraine, because and headache diseases, a lot of people don't really understand what kids are going through, and parents, I know what you're going through. I went through it too with my child, 2 of my 3 daughters. So, please take advantage of our support. Thank you everyone for being here, and have a good rest of the day.
Thank you.
Bye, everyone.
Bye-bye.
Thank